We've been looking at patients who die by suicide who are over the age of 75. It turns out that they don't have the profile of risk factors of younger patients. They don't have the same rate of self-harm or drug or alcohol misuse, but they are more likely to have physical ill health, to be bereaved or isolated. They're often people suffering from depression and often of recent onset, and it's recognising that different risk profile that we're suggesting to services in this report. We've also been looking at the other end of the age spectrum, young women under the age of 25 who die by suicide. They have a particularly high rate of previous self-harm, so putting it more positively, an opportunity to intervene. Quite often, young women who die have a clinical complexity, not just self-harm, but diagnostic comorbidity, sometimes a diagnosis of personality disorder, alcohol and drug misuse. And that clinical complexity, although it adds to risk, makes it more difficult for some services to accept them for therapy. We have to, in our services, accept the complexity that many patients present. Because of the current public concern over homelessness, we looked at patients who died by suicide while they were homeless, and we found that there were about 40 suicides a year among homeless patients. Their risk profile wasn't straightforward. For some, they were young, usually male, with turbulent histories behind them, histories of self-harm, sometimes violence, alcohol, drugs, including some of the new psychoactive substances. But there was another group, a little bit older, usually male, who didn't have that kind of history. Instead, they were men who were depressed, who were facing financial problems. And again, there's a message to services about being conscious of how different the risk profile of individual groups can be. There's also been quite a lot of public concern about the role of the internet in increasing suicide risk, particularly in young people. So we've looked at the number of mental health patients who die by suicide having used the internet in a way that was suicide related, using social media or chat rooms or looking for methods. We found there were 65 deaths a year among patients who'd used the internet in this way. But they weren't all young patients. They were quite a diverse group in age and sex and diagnosis. And it raised the question for clinicians. How often do we talk about online safety to our patients? That has to become an important part of risk management in the future.